Welcome to the IBS Nutrition Podcast, your go-to source for navigating the complex diagnosis of irritable bowel syndrome. Here, we dive deep into IBS and discover the power of diet and lifestyle to find freedom from your IBS symptoms. I'm your host, Jessie Wong, FODMAP dietitian and a gut expert. For years, I suffered from debilitating gut symptoms that kept me out of work, feeling constant discomfort in my body and anxious around food. Today, I'm in control of my IBS, able to eat the food I love again, travel whenever I want, and spend quality time with loved ones. It is my mission to help you do the same and transform the way you live with IBS. Let's get started. Welcome everyone to the IBS Nutrition Podcast. I'm Jessie Wong, your host, and today I am joined by my wonderful co-host, fellow IBS dietitian, Brooke. Hi, Brooke.
Hi, everyone. Hi, Jessie.
Hi, I'm so happy for you to be here. And today we are diving deep into irritable bowel syndrome. And what are some of the IBS symptoms that are more common, less common, and why tracking your symptoms can be a game changer in managing your IBS? A topic that both of us are incredibly passionate about. And before we dive into the topic, I want to make a quick note. Today is World IBS Day, and I want to give you a few statistics to share with you that you are not alone. And because IBS is an invisible illness, we like to call that here because nobody talks about it. Everybody's worried about talking about it. Sometimes it's embarrassing, or sometimes they've talked about it enough that they're being written off by everybody around them whenever they mention it. So it's best to just not bring it up so that you don't feel like people are gaslighting you. But we want to remind you here that this condition affects up to 10 to 15% of the world population, and we are talking about up to 45 million of Americans alone. So you are definitely not the only one out there. And on average, it takes 6 years to get a diagnosis. In this episode, we're going to talk about different symptoms that you need to track to hopefully help you get to the correct diagnosis faster. And 2 in 3 IBS patients are female. We don't fully understand why the condition affects women a little bit more than men, but we know that it does, and it really does significantly affect a person's quality of life. Now, IBS sufferers usually restrict their activities roughly around 73 days out of 1 year because of their IBS symptoms. So if that's you, you want to listen to our episode today so that we can share with you more about symptoms and maybe also some strategies on managing your symptoms as well. And another staggering statistics, it was a survey that was done internationally, about 2,000 participants. And a majority of them voted to say that they are willing to lose 10 to 15 years of their life for an instant cure of IBS. I want you to just think about that for a minute. That really tells us how much burden or how difficult it is to deal with IBS. So much so that people are willing to cut their life short for an instant cure. And I think that's just not talked about enough. And there are a lot more research going on in IBS, and we're still learning so much about it. But a lot of the times, we feel like, or patients may feel like, yes, this is not a life-threatening condition. I'm not being taken seriously. Well, you know what? You're not alone in that. And we take IBS very seriously here. Brooke, what do you think of the statistics?
Yeah, it really is kind of astounding. I mean, 10 to 15 years off someone's life, it just shows what kind of a huge impact IBS can have on people and how debilitating it can be, even though there's technically, nothing functionally wrong.
Mm-hmm. Exactly. Okay. Well, today we are going to talk about IBS symptoms, and why tracking your symptoms is a game changer. And we are really passionate about talking about tracking symptoms because it can really tell us so much more about what is going on.
So for our listeners that are new to the term, what exactly is IBS?
Okay, great question. So IBS, or Irritable Bowel Syndrome, is a chronic condition that affects the large intestine mainly, and also our gut-brain connection. It's like the digestive system's version of a troublemaker. Sometimes it's calm, and other times it throws a bit of a tantrum, right? And symptoms can include abdominal pain, bloating, gas, and changes in bowel habits. And also constipation or diarrhea, and sometimes maybe both. And it is important for us to know that IBS is a combination of symptoms. So because we call it irritable bowel syndrome, like there's no specific damage to the gut or the digestive tract. However, there is a bunch of symptoms that we look for when we are getting a diagnosis of IBS.
Yeah, it's so common. We don't, in general, talk enough about it. But what do we know what causes IBS?
Right. This is a great question, a very complex one. So, to date, we don't fully understand what causes IBS. However, we know there are many different root causes to different types of IBS. And it's very important to understand your personal root cause. But again, there's just no one size fits all exact cause of IBS. But factors like gut sensitivity, gut motility, psychological stress, and sometimes maybe food intolerances can play a significant role in the condition's manifestation. And there's also a new aspect that we're still learning more about is how our gut bacteria and diet influence IBS symptoms, especially when it comes to fermentable carbohydrates such as FODMAPs. And we're definitely going to talk about the low FODMAP diets, but maybe in a future episode.
Yeah, we will definitely dive deeper into FODMAPs in a future episode. The American College of Gastroenterology categorizes IBS as a functional gut disorder, and they recognize it as a disorder of the gut-brain interaction. So it's not just about the digestive system's physical condition, but how the gut talks with the brain and how the interaction between the gut and the brain can play a crucial role in how your IBS symptoms manifest.
Yeah, absolutely. And the gut brain axis, right, what we usually refers to is a complex network of signaling pathways between the GI tract and the nervous system. It involves many components, such as our gut microbiome, our immune cells, our neuroendocrine cells, which all of them contributes to how the brain perceives sensation from the gut. And in IBS, the communication can become dysregulated, meaning that normal digestive process may be experienced as painful or uncomfortable, and stress or psychological factor can exacerbate GI symptoms.
Yeah, it's really important to understand IBS as a disorder of the gut-brain interaction, because then it helps us manage the symptoms more effectively. It helps us acknowledge the importance of not only addressing just, dietary and lifestyle factors, but also considering stress management, psychological well-being, and that these are really integral parts of treatment. And so this comprehensive approach can really help us manage symptoms and improve the quality of life for people living with IBS.
Absolutely. Okay, now on to our second topic for this episode. What are some common IBS symptoms, not so common IBS symptoms, and what are some red flags that we really want to, investigate further that may not be related to IBS or maybe related to another condition that have very similar symptoms? So, Brooke, there are many, many different IBS symptoms. Can you give us some examples?
Yes, bloating, gas, constipation, diarrhea are the most common symptoms that we see. They can change from constipation to diarrhea, but those are the most common symptoms we see.
Right. And what about some less common symptoms? And we actually see them quite a bit as well.
Yeah, reflux, nausea, fatigue. Those are the slightly less common symptoms. I don't actually see too much nausea usually, but reflux and fatigue for sure. Yeah.
Yeah. And sometimes we see nausea kind of related to IBS constipation, but people may not necessarily make the connection. Okay. This is a very important thing, right? So we just mentioned a bunch of symptoms that could be related to IBS. But one thing we really want to point out is that all GI conditions have the same symptoms. And it is really, really important for you to go to your doctors and get tested for the other conditions first before getting an IBS diagnosis, because all of the GI conditions, it's all symptoms in your gut, right? And it's hard to tell whether it is from, say, celiac disease or inflammatory bowel disease, where these two conditions do change the structure of your gut. There are markers that we can test for in blood tests, in stool tests, or maybe scopes. And it is really important to document your symptoms, bring it to your doctor, and then they decide what tests to perform to rule out these other conditions for you before giving you an IBS diagnosis. And because of this, diagnosing IBS could, be a long and difficult journey. And again, per research, it takes about 6 years for patients to get an IBS diagnosis since first experiencing symptoms. Now, we are getting better at this. I want to say that, the medical community is getting better at testing and ruling out other conditions and giving people an IBS diagnosis. But, it still takes time. And one thing it really helps the patients to get to the correct diagnosis faster is documenting your symptoms. One way, to really speed up the process, right, is keeping a detailed symptom diary. This means recording what you are eating, what symptoms you have, the location of the symptoms, the duration, and the frequency of your symptoms. So these information can be tremendously helpful to create a clearer picture of your condition and also potentially leading to a faster diagnosis. And beyond diagnosis, it can help assist in managing your condition to identify your triggers and maybe creating a personalized treatment as well.
Yeah, Jessie, I think it's important to track your symptoms, track your bowel movements, and then be able to go back to your doctor and say, this is what I've eaten, this is what I've tried, this is what diet I've done, and this had an impact, this didn't have an impact. And then that can help them, in the short amount of time they have with you, pinpoint what's going on.
Mm-hmm. And choose the right treatment option,
yeah,
right?
Yeah, and get you a diagnosis faster, hopefully.
Right. Yes, and because there are a lot of IBS mimickers that don't always get tested, and we see that quite a bit in our clinic too. And sometimes we may suspect patients have bowel acid diarrhea where it burns, and sometimes people have diarrhea at nighttime. Now, these are red flags that you want to bring up with your doctor if you have to wake up from your sleep and run to the bathroom. That's not IBS. You really need to dive deeper with your doctor and figure out what is wrong. And then another red flag that you have to go to your doctor and get tested and see if anything is wrong is if you have blood in your stool. Now, a lot of people have hemorrhoids. If the blood is from the hemorrhoid and it's persistent and you've done scopes and make sure it is hemorrhoid, then it's probably okay. But if you have not been to your doctor, if you've not gotten scopes done or maybe biopsies done, and you have persistent bleeding in your bowel movements, you have to go see the doctor.
Mm-hmm.
And another thing, this is something we kind of do in our clinic too, right? It's looking at nutrient profile of our clients. So we request some labs. And another red flag we see is if people have iron deficiency anemia. That usually is an indication of malabsorption or maybe bleeding. But usually when a patient comes to us, they've already done all the scopes, all the tests, ruling out other conditions. But if they have deficiencies, then we really want to dive deeper to see if there is an overlapping condition on top of IBS, because IBS does not cause anemia.
Mm-hmm.
It causes a lot of discomfort, but not necessarily anemia. And these are things, a really experienced GI doctor will be able to work with you on it, or maybe a very experienced primary care physician can help you with it. And a lot of the times what we do is we work with a patient's physicians to get these tests ordered and also explain the results to maybe the patients and also their physician as well, and tell them what we think, that if we think there is further workup needed.
What labs do you like to see from clients?
Right. So in our clinic, right, we always want to see the celiac test. We want to see inflammatory bowel disease test. So celiac test could be serology. So blood tests could be endoscopy, where they take biopsies from your small intestine to make sure there's no inflammation in specific parts of your small intestine to rule out celiac disease. One thing about celiac is 1 in 100 in the population has celiac disease. Only 20%, about 20% are diagnosed. And oftentimes it's underdiagnosed or misdiagnosed as IBS. So we always want to review those labs to make sure that you've gotten a celiac test done. Or if, there's something else going on, we want to dive deeper and maybe asking for more tests in regards to this area. So celiac. Now, inflammatory bowel disease is labs that we will review for a patient. So that could be calprotectin from the stool test. It could be colonoscopy and biopsy to see if there's inflammation. So we are not one to diagnose, but we can review the test to make sure it wasn't overlooked by your doctor. So those two are tests that we see all the time. What else do we see? H. pylori. We want to sometimes, if it's more upper GI symptoms, we may request to do a breath test or maybe a stool test to rule out H. pylori. This is especially true if a patient have had previous positive H. pylori. And sometimes this is one thing to think about. If you've had a positive H. pylori test, have gotten the antibiotics to treat your H. pylori, one thing the literature suggests is get tested again to make sure you are negative. And sometimes we don't see that being repeated. Mm-hmm. And it is important to make sure you don't have H. pylori before before getting an IBS diagnosis, because it could potentially be H. pylori. Mm-hmm. What else? Well, if we see, so one thing we see in our clinic is looking at what patients are eating, their medical history, looking at what symptoms they have, what their stool looks like. And one of the things we look for maybe is the stool color change. If there is change in stool color that we suspect something else is going on, we may ask for tests for EPI, exocrine pancreatic insufficiency, or like we said earlier, bile acid malabsorption or bile acid diarrhea, because these two conditions will require medications. And it's a very easy fix. And they usually cause more diarrhea than constipation. But then again, like these are overlapping diagnoses with IBS that are sometimes not diagnosed. And I was reading a research paper from Michigan. University of Michigan has a huge gastroenterology department, and they publish a lot of studies, and they were suggesting maybe up to 20% of IBS patients may have bile acid malabsorption, leading them to have nonstop diarrhea. And these are the cases that patients may not be responding to just the low-FODMAP diets alone. Now, am I missing any other test?
Well, I think when someone has chronic diarrhea and we suspect it might not be IBS, B12.
Oh, yes.
And that's not something that your doctor will just test for. We usually have to ask people to ask their doctor for it. Yeah.
And that's something we ask for most of our clients. If we suspect a deficiency, we'll ask for ferritin to check their iron status. We'll ask for vitamin D level to see if they're malabsorbing fat-soluble vitamins, and B12 and folate. These are the ones that we sometimes see people are malabsorbing, maybe due to an overlapping condition with their IBS. Mm-hmm. And we make recommendations accordingly if anything shows up to be deficient. And these are maybe vitamins or maybe iron supplements that we may recommend. Now, if you are seeing a provider that are making blanket recommendations on taking supplements, be careful with that. And usually we really want to see the blood work first before making any of these recommendations. Okay, we are talking a lot about symptoms. Should we move on to our third topic, and why tracking and documenting your symptoms is so important. And we'll kind of walk you through how to track your symptoms as well. So I'm just going to dive really deep in here. Okay, documenting your symptoms will be a game changer. I'm not even going to say can be a game changer, because it will be a game changer for anyone with IBS. And we talked about different types of symptoms, right? We talked about bloating, pain, gas, and changes in your bowel habits. But documenting your symptoms is not just about what symptoms you are experiencing. It's also about understanding when they start, how long they last, how often they occur, and how severe they are. So these are the type of detailed tracking that can really help your provider understand better what is going on, okay? I'm going to use bloating as an example. And most people don't understand this, but there are different types of bloating a person may experience, even within IBS. And that can give us some indication of what may be going on with your gut, and how to create a treatment plan for you. So number one thing we always ask is, where is your bloat? Is it upper GI? Is it lower GI? Is it a specific corner of your abdominal area? When does it start? Does it correlate to what you are eating, or does it correlate to bowel movements or the lack of a bowel movement? How long does your bloating last? And how often does it happen? Do you bloat overnight or do you bloat after something triggers it? So these are crucial information. So when we talk about tracking symptoms, it really is talking about detailed tracking of all these information about particular symptoms. And you do this for every other symptoms that you have. For example, pain. Again, where is your pain? When does it start? How long does it last? Does it correlate to food? Does it correlate to your bowel habits or maybe even gas? And how often does it happen? And these can really tell us where the problem is when it comes to your IBS and what to do. What are the next steps to help you find relief or maybe really understand what is going on? And I think that's so crucial when you don't know what is going on. What do you treat, right? I want to mention to everybody who is listening here, we have a symptom tracker that is extremely helpful for you to learn more about your body. Ultimately, to manage IBS is understanding your body. It's not taking random supplements. It's not cutting out food with no end, but it's really understanding what triggers your symptoms. So we have a free symptom tracker for anybody who needs to learn more about their body. And it's on our website, pooppedia.org/resources. So it's Poopedia, PEDIA.org/resources. There you'll find a free symptom tracker. It's amazing. It's very useful. Print it out and start tracking your symptoms. And on our symptom tracker, we ask you about how much fluids you're drinking, how much fiber you're eating, what type of poop you have, what type of symptom you have. We have a diagram of a torso on there to tell you where, different areas are. So when you're tracking your symptoms, you understand, where the symptom is located at, how long does it last, how often does it happen, write it all down, see if you can see any correlation between your symptoms to what you're doing. Oh, on the tracker, we also ask about your stress level too, about whether you are doing exercise and what day you are on your menstruation cycle. And this is especially important for women because, yes, your hormones do affect your bowel habits and it does affect your symptoms as well. And it's really important to track that.
Yeah, so it really is important to track your detailed symptoms. And like Jessie said, the more detailed, the better. And we review journals at least twice a week. And that's when we can really see the impact what you're eating is having on your bowel movements and your pain and your bloating, and also stress, or really any factors that are coming up in your life that may be impacting your symptoms. And it really is also great to see with the changes that we advise people to make, how they get better and how their symptoms get better, how they feel better, how their bloating can decrease. So not only is it helpful to get your diagnosis, but once you have it, it can be really helpful to manage your symptoms. So Jessie, do you have an example about how this really helped one of our clients?
Yeah, actually talking about symptoms and why tracking symptoms is so important. I do have a client story, and this is actually a dietitian herself that came to us because she had IBS diarrhea. Okay, hear me out on this. So she was having a lot of diarrhea. She didn't know what was causing her diarrhea. She went to her PCP, went to her gastroenterologist, got a lot of tests done. Everything was ruled out, and then got an IBS diagnosis. And this is when she would trial medications and also supplements, but none of them stopped her diarrhea. So her doctor recommended for her to try the low-FODMAP diet. And being a dietitian herself, she knows that she would need help with the low-FODMAP diet because it's not very straightforward, which we'll dive deep into in a different episode. But then she came to us, and at that time, she has already cut out 50% of the food that she was eating because she was so afraid of food. And she was still having diarrhea, and she was afraid of even going on a car ride for just 10 minutes because she doesn't know when it would strike her. It made it difficult to live her life, go to work, or even socialize. It was just devastating. And we know, right, working with patients with diarrhea is unpredictable. It's extremely debilitating. It makes it difficult to do things, to do life. And we know that, by resolving diarrhea, people will be much happier. But anyways, she joined the program because she was recommended to try out the low-FODMAP diet. Now, when she started, the first thing, of course, we do with her is looking at what she's eating, what symptoms she has, and what type of characteristics her symptoms had. And looking at her bowel pictures and asking her more in-depth history of her diet, her bowel habits, what we learned was that she didn't really have IBS diarrhea. And what she had, according to her symptoms and what she told us, was that she had overflow diarrhea. Yes, it is a type of diarrhea, but it is actually caused by chronic constipation. So with overflow diarrhea, what happens is that there may be stool stuck in your rectum or colon. That could be from chronic constipation. But it's stuck in there. It's a solid thing that's blocking everything else from coming out. And in cases like this, people actually tend to have more diarrhea. But every time they eat something or they have any stimulation, they will need to run to the bathroom. But only watery and mushy pieces of stool will come out. So the stool doesn't really come out because there is a blockage. And that's what we actually figured out she has. So instead of IBS-D, she's more like IBS mixed bowel type, but more so actually constipation was the root cause of her diarrhea. And once we knew that, that really changed our whole approach in how to help her or guide her through what to do next. So instead of moving through with the low-FODMAP diet, which was what she came to us about, we actually suggested her to work on her constipation, right? The first thing we did was, let's try some laxative and see if it helps you. And guess what? As soon as she was having better evacuations every day, her diarrhea stopped completely. And I think sometime in the middle of the program, so she joins our small group program, and we worked together for 14 sessions together, and it is a 3-month program. And sometimes through the middle of the program, she said this, like, how did I not notice it before? Like, how did I not know that if I have good poop, a good bowel movement, I don't have any of my GI symptoms? And this is a really big, indication of why checking your symptoms and understanding your body is so important, instead of blindly following a restrictive diet that may or may not help, right? And for her case, she came to us for the low-FODMAP diet, but we did not do the low-FODMAP diet. And one other reason why is because she was already so afraid of food. She's already cut out so much food. So what we really worked on was guided her to regulate her bowel habit. And we also guided her to food reintroduction sooner rather than later, because very soon after regulating her bowel habit, her symptoms subsided drastically. She still had some symptoms, but it's way easier to manage. And we did the food challenge one group at a time and bring it back to see if she has any intolerances or what her tolerance level are for those food. But at the end, she didn't have any food intolerance. And what we really needed to do was to regulate her bowel habits so that her diarrhea stopped. Mm-hmm. And the good thing is she agreed, because sometimes a lot of patients come in and be very stubborn. It's like, my doctor said I have to do low-FODMAP and I have to do low-FODMAP. Now, we're not going to argue with you if you need to, but when it's unnecessary, we would recommend against it. Or at least let's try something else first before doing any elimination diets, because all of these diets have their own risk. When we're doing it, it's not benign. It can cause other problems down the road. Mm-hmm. So she went from having a lot of diarrhea, being afraid of sitting in her car for 10 minutes at a time, to actually at the end of the program, she picked up a different job. She was able to apply for other jobs because she doesn't have to stay near her proximity. And she was working at a facility where they help people have better relationship with food at the end. And she had to drive an hour to that facility and back every single day. And she had no fear of needing to stop to use the bathroom without even, going through an elimination diet, because she knows her body a lot better. Now, I'm sharing this because, tracking your symptoms can really tell you a lot about your body. and avoid unnecessary food restrictions or supplements, right? Don't waste your time or money on supplements that you don't need. And don't waste your time on elimination diets if you don't need them. There are indications where we think an elimination diet is needed, but it's not always the case. And understanding your body first is more important than just cutting out food, because you're wasting time and money on things that is not helpful.
Yeah, it's so interesting with the original diagnosis, because someone's going to the doctor for diarrhea, but when you dive a little bit deeper, and only until you dive deeper and track your symptoms are you going to figure out that it's not diarrhea, it's actually constipation. So no need for a strict elimination diet, which is great.
Right. It is great. I mean, those diets are not benign, and we know that. And if you're ever recommended trialing any elimination diets, work with a dietitian, because these diets are not benign. They can cause harm in the long run. Okay, well, that completes our first episode here. And thank you so much for everyone who are listening. We hope this is helpful for you. And we can't wait for you to hear more, because we do have a whole host of topics in line for you. So today we talked about symptoms. Next, we're going to talk about tests. We kind of touched on tests this time, but we're going to talk more about what type of tests you will need, what type of tests you don't need next time. So stay tuned.
Bye.
Thank you all. Bye. Thank you for tuning into the IBS Nutrition Podcast. We hope today's episode has brought you closer to understanding and managing IBS. Remember, you are not alone on this journey, and finding freedom is possible. For more on IBS, make sure to follow us on your favorite podcast platforms, and please leave us a 5-star review. We would really appreciate that. You can access links mentioned in this episode in the show notes to learn more about your type of IBS and how to identify your own food or lifestyle triggers. Register for our free IBS Masterclass, 3 Steps to IBS Relief, for our proven holistic 3-steps approach to managing IBS once and for all. Head to ibsdietitian.com/masterclass to register. Until next time, take good care of your gut, and here's to your health and happiness.